Yes. मैम मेरा सिर्फ मतलब स्टैंड ही बाकी था ना, बाकी तो ठीक ही था शायद।
नहीं, प्रोसेस ऐसा प्लेन नहीं होना है। स्टैंड नहीं है का मतलब पूरा रॉन्ग है, तो पूरा जैसा कार्ली ने दिखाया था वैसा बनाना है। हाँ, अगर तुमको फिर भी कंफ्यूजन है तो यू कैन कीप ऑन व्यूइंग द वीडियो दैट आई यूज्ड टू अपलोड। ओके कोस्टा?
Yes ma'am, yes ma'am.
Okay, and this is not only for Costa, this is for everyone. I think many people, you don't even know how to make paper bag also. Okay, so okay, so let's not waste time in the paper bag. So let's mainly focus on today procedure. Okay. So that day today I'll be teaching you all preparation of the patient. Okay, that is the main procedure of taking TPR. So preparation of the patient. So first of all, how you need to prepare the patient is, first of all, you have to provide a comfortable position, okay, according to the selected site. So before you were we were discussing about which side we will be taking, which side will be more comfortable, preferable for taking temperature, pulse, respiration. Now we have assessed everything. Now we will prepare the patient. So how you need to prepare the patient? You have to provide a comfortable position according to the site that you have selected. Okay, suppose you have selected to take the temperature in axilla. Okay, so after like making it sure that you have selected the site, now you should put the patient in a comfortable position according to the site you selected. Are you clear, all of you?
Yes, ma'am.
Yes, ma'am.
Next, after that, you give him a comfortable positions. Now what you need to do, you will explain the procedure to the patient. Okay, patient को बोलना है that मैं ये perform करूँगी, वो perform करूँगी. You have to explain the procedure to the patient, and also not only explaining, you have to check the ability of the patient to follow instruction. Okay, because when you are taking the temperature, when you are taking the pulse and all, like you will give instruction to the patient na कि ज़्यादा बात मत करना, और फिर when you put the temperature in under the armpit, that is under the axilla, at the time also like the person have to put the hand na over the chest. So at the time also you have to instruct na हाथ ऐसा रखना है, chest का ऊपर ऐसा रखना है. You have to show that demo na all those things. So while you are giving the instruction, whether he is able to follow the instruction that is provided by you or not, that you need to assess. Okay? Yes or no?
Yes, ma'am.
And you have to
Yes,
check for, you also have to check for contraindications of taking temperature, okay, by the specific group. Contraindication देखना है. You know what is contraindication? You have to see the contraindication. Contraindication. Simple example बोलती हो. Suppose you saw a patient, okay, and he have a fracture over his left hand. Okay, उसका left hand में उसका वो fracture है, तो he or she find difficult to move his hand. In that case, you will prefer the right hand, okay, to take the temperature. Okay, क्योंकि left या right कहीं पे भी ले सकता है ना, तो so contraindication देखना है किस तरफ में लिया नहीं जा सकता है. Okay, that is the one thing. And the other thing is that you can also assess na saline, जहाँ पे जैसे कि when you try to take the pulse, अगर like हाथ पे कैनुला लगाया हुआ है तो you will find difficult to, saline लगाया हुआ है तो you will find difficult to feel the radial pulse na. So in that case, the most preferable side is the other hand where no IV infusion is given. Are you clear?
Yes,
sir?
ma'am.
Yes, ma'am.
Okay. Next, preparation of the articles. Articles. I'll show you all next time this one, the picture. Okay. Now I don't have this picture along with me. And these some of the articles, okay, that are needed for checking temperature. Okay, so what is the most important instrument that is needed to check the temperature? Jaldi bolo.
Thermometer.
Very good, thermometer. And in hospital we mainly use what? Clinical या digital wala?
Clinical.
Yes, very good. Clinical thermometer. Okay, clinical thermometer is mainly preferable. So you need to know the articles as well as the rationale. Okay, क्या के लिए use किया जाता है? Suppose you are holding a thermometer, people will ask you, this thermometer is for what? You have to say the rationale. I'm taking this thermometer because I want to take temperature. That is done. Next, that particular thermometer, okay, that particular thermometer where you want to take the temperature, okay, that particular thermometer should be put inside a bottle. Should be put inside a bottle. छोटा सा bottle या फिर छोटा सा bottle के अंदर like वो रखना है वो जो thermometer है you have to dip inside the bottle, okay, and that particular bottle where you need to dip the thermometer that should contain solution, okay, that should contain solution. What solution? Dettol solution या फिर Savlon solution या फिर fair general solution is there, but no need that one. You can simply remember Dettol and Savlon, okay. So उसका जो ratio है ना 1:40 होता है. You can just write it down for your for your knowledge. ये जो thermometer है एक bottle के अंदर रखना है और उस bottle will contain 1:40 ratio, okay, of Dettol. And Savlon जो है Savlon का भी 1:40 ratio होगा. So do you know the meaning of 1:40? If no, I'll explain. Silent indicate you know na.
No, ma'am.
Ma'am.
Okay. Okay, so 1:40 का मतलब है ना means 40 ml of water लेना है, okay, एक bottle पे 40 ml of water लेना है and 1 drop of Dettol solution, okay. In the same way, in case of Savlon solution also, you have to take 40 ml of Savlon solution with this 1 ml of Savlon. Are you clear?
Yes, ma'am.
Yes, ma'am.
And these particular things ना अगर hospital में जाने से जब like every time to fresh one unit ना, so suppose you are asked to give a demonstration on the TPR, so on the spot you have to perform. So suppose you bought a Savlon solution and you bought a water, okay, so you just need to know how to mix it, everything you need to know. So even in the hospital, if it is not available, also in emergency, if someone requests you to take the temperature also, if you know the procedure, you can prepare by yourself, okay. Just एक bottle पे 4 ml of water लेना, उसके बाद अगर Dettol solution add करना है तो उसको 1 drop या फिर 1 ml देना. Savlon का भी same thing, okay. And one important thing is that in that particular bottle, okay, that contains Dettol solution, so that particular bottle you have to dip the thermometer, right? So the minutes that the amount of minute that is required to dip, okay, in that Dettol solution is 5 minutes. 5 minutes. मैंने अभी थर्मोमीटर उस Dettol solution के अंदर मैंने अभी थर्मोमीटर डिप किया, तो I should make it sure that I dip that particular thermometer for 5 minutes. Are you clear?
Yes, ma'am.
Yes, and in the same way for the Savlon solution, even though the ratio is same, but the amount of the amount of minute that you need to dip is quite different, okay. For Savlon it is 3 minutes. 3 minutes. Okay, so again you will be asked, why are you performing this procedure? Why did you dip the thermometer inside the solution? Is it required? If people ask you, you should again know the rationale. The rationale is to disinfect the thermometer, okay, to disinfect the thermometer. Are you clear?
Yes, ma'am.
Okay, okay, very good. Okay, and in the same way, you there should also be an article that is a bottle which contain a plain water, okay. Means Savlon solution होने का साथ एक container पे या फिर एक bottle पे plain water भी रखना है. Okay, how much you want to keep, that depends. So you have to keep, and again there is a rationale. Why is it necessary to keep that plain water? Okay, the rationale is that in order to rinse the thermometer. तो rinse तो you know ना thermometer का ऊपर पानी डालना है, उसको साफ करना है. After you take the after taking the temperature of the patients, you have to rinse it. Are you clear why plain water is necessary?
Yes, ma'am.
Okay, very good. Okay, so there are छोटा छोटा सा cotton swab होता है, हाँ, cotton बड़ा सा cotton hospital में मिलने से भी, like if you find a small big huge cotton also, like try to make it in a, like we call it as cotton swab, okay, like try to make in a small piece, छोटा करके, like try to make in a small goal, try to make it, okay, that in order to make it a swab. So there are 3 types of swab, okay, that need to be kept in the TPR articles. Those are cotton with swab wet swab we call. जो cotton है ना, it should be wet. पानी में थोड़ा, like पानी के साथ थोड़ा mix करके, that should be wet. That particular cotton need to be wet. It should not be like dry for the first one. Are you clear, all of you? छोटा सा गोल बना के, so that you can keep it in a small container.
Yes, ma'am.
Okay, and if you have the wet swab, you should also have what?
Dry swab.
Very good, dry swab. Okay, there used to be a different container. Okay, छोटा container होता है, तो छोटा container में एक में wet swab रखो और दूसरा में dry swab रखो. Okay, in the same way, there is also a swappy swab, SOAPY, swappy swab. Swappy swab का मतलब है, like we put the Dettol or Savlon or थोड़ा सा, like any kind of disinfectant, soap and all ना, all those things you just need to put upon that. जैसे कि मेरा सामने में Savlon का साबन है, okay, you just need to wipe upon that cotton, and you keep in a container. Okay, means that cotton should contain all those swappy, the swappy swab. Okay, जो भी Dettol या फिर Savlon, जो भी साबन थोड़ा लगाना है उस cotton का ऊपर. Are you clear?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, so this cotton swab, okay, this cotton swab means cotton wet swab, this soapy swab, all these are needed, okay, in order to clean the thermometer before putting in disinfectant, because before you put the thermometer directly into the disinfectant solution now that you will be preparing, before that you have to clean with this wet swab. Okay, you have to clean with the wet swab. So remember that you have to clean with the wet swab. And the other one, all those swappy swab, all those dry swab and all, na, you have to clean the thermometer. Okay, means you have to, in order to dry the thermometer, that you need all those another swab. I mean that all those dry swab and all. Okay, क्योंकि डिप करने के बाद तो ऑब्वियसली अगर डिप करने के बाद डायरेक्ट थर्मोमीटर को उठाएंगे ना, तो वो वेट होगा, तो डायरेक्ट पेशेंट का वहां पे तो नहीं रख सकते, तो यू हैव टू क्लीन इट, यू हैव टू ड्राई इट. आर यू क्लियर?
Yes, ma'am.
Yes, ma'am.
And now you will be using means you will be needing kidney tray. Okay, and you all know that kidney tray we mainly use in order to discard the liquid waste. Okay, जो भी पानी या फिर जो भी liquid waste है, that used to be thrown in the kidney tray. Okay, and besides that there is also a paper bag. So ये जो paper bag है, this is also used, okay, to discard the dry to discard the dry swab and all. Okay, all those things. Or you can simply call it as kidney tray and paper bag. Their rationale is to discard the soil swab. Soil means जो गंदा चीज है ना, वो सब. You can simply write in the rationale to discard soil swab. Are you clear?
Yes, ma'am.
Okay.
Yes,
And
ma'am.
there is also a feeding cup, okay, with water, which I already explained you all. A bottle containing plain water, or else you can also call it as a feeding cup. भी ऐसा होता है, feeding cup with water means to wash the thermometer after use. माने thermometer after use After use, in order to clean that, there is also a feeding cup with water. Okay, so if one is enough, one is there, then it is enough. But just we also call it as feeding cup. That's why you, if you know it now, both the meaning, then it's good. Okay, and I already told you all now that we should also have a TPR seat. So TPR seat though, like I think it's in my hometown. I'll try to bring one once I go during the puja vacations now. Then after that, I'll be able to show you all. Right now in Guwahati, I don't have. So TPR sheet, TPR sheet is required, okay? And in TPR sheet, yesterday I told you all, now you have to have pen. What color were they that I mentioned yesterday?
Red and blue, ma'am.
Yeah, red. Yeah, yes, red, blue is written. But nowadays, what happened is that we used to use three things, okay? That I would like to add that because they're blue, red, and black. We used to use black pen, blue pen, and red pen use kiya jata. And blue pen, do you want to know which color is used for marking which vital signs? Do you want to know?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay. So this blue color pen, na, हम जो normally use करते हैं, this blue color pen, it is used for marking respiration. It is used for marking respiration. And then ये जो red color pen है ना, red, ये जो pulse को mark करने के लिए, like it is used. Pulse. The red pen is for pulse. All these things I think you won't find in books and all, but these are practically that we used to be taught. Okay, blue pen for respiration, temperature for black. Okay, TPR हो गया तीनों का, TPR. TPR. T is marked with which pen?
Black pen.
Very good. P is marked with which pen? That is pulse.
Red pen.
Blue.
For respiration.
Okay, very good. All of you are clear, right?
Yes, ma'am.
Okay.
Yes,
And
ma'am.
there is again rationally. There is again rationally. You will be again asked, why are you marking with blue, red, or this pen? Okay. The answer is to record the TPR. Okay. Because there will be a TPR sheet. In order to record that, we need to use this. Okay. And so that people won't get confused. Okay. Because 2-3 lines same color में mark करोगी तो people will get confused, na? So that is why medically it is being like launched. Means like the differentiation of the color is being like made. Okay. So and there are some extra articles also, okay, which is needed for rectal temperature and axilla also. This means rectal is not preferable; it's not required also. Like you can take. Yeah, if in case if rectal temperature now, if people used to tell rectal temperature, then I just want to tell you all, even though it is not used anymore, okay, but just know that for rectal temperature we used to take gauze piece extra gauze piece चाहिए होता है. In order to separate the buttock, means, but in order to separate the buttock you need to use the gauze piece, okay, to clean it, because you have to insert upon this in your rectum, na? So you have to clean it to separate the buttock. Extra gauze piece is needed, okay. Then that particular side is very dirty now, so you will need clean gloves also. Okay. Why you need the clean gloves? In order to protect the hand from contamination. Okay. Contamination का मतलब क्या है? Contamination.
Infected, ma'am.
Pardon, Carly, what did you say?
Soil or infected, ma'am.
Yeah, soil. Okay. Soil. We always try to use this. You are in the medical profession. Always try to use this. Contamination is contaminated. Okay. Okay. Before Silchar was known as the dirtiest city, na? So Silchar is such a contaminated place. You can say like that. Such a contaminated city means it relate to soil or in relate to dirt. Are you clear? Is this an example?
Yes, ma'am.
Okay.
Yes.
Okay, so and then when we try to put the this rectal thermometer, तो obviously lubrication तो चाहिए होगा ना, उसको lubricate करने के लिए extra Vaseline भी चाहिए होगा, क्योंकि thermometer को lubricate करना है ना, you have to lubricate the thermometer, so Vaseline also might be required. And obviously where you will be exposed, you will expose the rectum of the patient. So obviously if people see na, it's the patient might feel uncomfortable na, so privacy is very much essential. So screen is required. Screen guard hota hai, hospital mein hota hai screen guard, तो screen provide किया जाता है, पूरा ढक देता है. Okay, and then we call it as a making toss. Okay, making toss भी होता है. Making toss ऐसा है, making toss is how to tell, it is like a plastic type का एक वो होता है, plastic type, प्लास्टिक या रबर टाइप का भी होता है और प्लास्टिक टाइप का भी होता है, जो एक मैट का जैसा है, मैट का जैसा है, that used to be cap. Okay, that used to be caps, means upon that making toast, it's waterproof also, means upon that they used to keep the patient. Okay, they used to keep the patient in order to protect the bed, okay, from covering. This is mainly used in the pediatric patient, bachon mein, in this one, in the baby and all. Okay, yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
And then when you are trying to take the and the extra articles are now, jab temperature axilla mein, you want to take the temperature from the axilla na, and then means that is the armpit. If you want to take, then what happens is that you need a gauze piece, क्योंकि अगर patient का axilla ज़्यादा ही गंदा है, तो you might need extra this one na, gauze piece. तो gauze piece extra चाहिए भी हो सकता है, small या फिर a small towel might also be required based on the patient's like hygienic conditions. So that are the important article way of preparing the articles. Okay, are you clear with the articles?
Yes, ma'am.
Yes, ma'am.
Yes. Okay.
Yes, ma'am.
Okay, these are the articles. Okay, there is no extra, it is this much. So if time is still there, then I would like to teach you all the steps of taking temperature. Okay, step of taking temperature. So whenever you try to perform any kind of procedure, so what is the first thing that should come in your mind? It relates to hygiene. Guess it. It relates to hygiene.
Question, ma'am.
What did you say? Question.
Can you repeat the question?
Suppose you are trying to start the procedure of anything, any demo, okay, जैसे कि TPR. So what is the first thing that you need to do? It relates to hygiene. सबसे पहले क्या करना है? अभी like you are ready to take the temperature ना, सबसे पहले क्या करना है? खुद को hygiene का related है, step भी सिखाया था.
Clean the articles, ma'am.
I have taught you all 7 steps.
Washing hands, ma'am.
Yes, hand washing. Okay, so hand washing, first of all, before performing any procedure or before performing any procedure, the first and foremost things you need to keep in mind is to wash your hand. Okay, so in case of taking TPR, you have to wash your hand, okay, for taking temperature. Okay, now you wash your hand, done. I'm audible, right? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, so you have washed your hand. Okay, for taking temperature, you already wash your hand. तो हाथ धो लिया, उसके बाद क्या करोगे? You will whatever articles that you have to prepare ना, you take the articles to the patient bedside. You take the articles to the patient bedside. Okay, and always right side is preferable, क्योंकि patient का बिस्तर का सामने में hospital पे एक table होता है ना, उसका table का ऊपर रखता है. So but always prefer to keep things or articles in the right side. Don't forget this, in the right side. Okay, so So you already washed your hand, you took the articles to the patient bedside, okay? And in case of rectal temperature, what you need to wear in your hand?
Gloves.
Gloves.
Very good, gloves. Jiban, please take attendance, okay? You can just take screenshot for now, okay? Okay, so so you have to wash your hand for taking temperature. You have to take the articles to the patient bedside, and you have to wear the gloves in case of rectal temperature. Okay. Now the rationale is, why do you need to do all these things? Because you want to reduce transmission of microorganisms and prevent cross contamination. Okay. क्रॉस इन्फेक्शन या फिर क्रॉस कंटामिनेशन को प्रिवेंट करने के लिए, और जो माइक्रो ऑर्गेनिज्म है ना वो ट्रांसमिशन ना होने के लिए you have to wash and perform this procedure, gloves and all. Okay, are you clear? The first step.
Yes, ma'am. Yes.
Okay.
Yes, ma'am.
Okay, now सब कुछ कर लिया, अभी क्या करोगी? Now you will explain the procedure to the patient and assess his condition. Okay, site for taking temperature. सब कुछ आर्टिकल्स भी बेड साइड में रख लिया, अभी दिमाग पे आना है कि मैं प्रोसीजर परफॉर्म करूंगी, तो I have to explain the procedure to the patient. So then you just take the history. Now you just take the history of the patient. Like what is your name? You are from where? What is your age? Okay, and then like where is your hometown? All those things you ask and write it down in your diary. Okay, all those things. And explain the procedure to the patient, okay, and you assess his condition. तो उसका कंडीशन देखना, उसका हिसाब से डिसाइड करोगे कि कौन सी साइट में टेम्परेचर लेना है. ओके, so now why do you need to explain the procedure to the patient and assess his condition site for taking temperature? Why do we need to do so? Because these will promote cooperation, okay, and reduce anxiety. क्योंकि पेशेंट को भी पता होगा कि तुम क्या परफॉर्म करोगे, तो you will promote cooperation and reduce anxiety. Are you clear?
Yes, ma'am.
Okay, next, the next step is you have to remove the thermometer from antiseptic solution. क्योंकि डेटॉल में रखना है ना 5 मिनट के लिए बोला, सेवलॉन से 3 मिनट्स के लिए कैसे बनाता है वो भी सिखा लिया. तो obviously article patient का बिस्ना के सामने में लाया, तो the thermometer is already deep ना, so you remove the thermometer from the antiseptic solution, okay, and then जो bottle में cold water रखा था ना, rinse with that. You rinse the thermometer. As soon as you take out from the antiseptic solution, you rinse in cold water, okay? And then after rinsing, you wipe from bulb to stem, okay, in a rotatory movement, okay? You have to wipe it. Will you use wet swab or dry swab?
Dry, ma'am.
Dry, very good. After rinsing with the cold water, like wipe from bulb to stem and then rotate it, okay? जब वो करोगी तो you have to rotate it. Wait, let me show you all. Okay, can you see me? I don't know.
Yes, ma'am.
Okay,
Yes, ma'am.
suppose this is the dry swab, okay? So I have to in a rotatory motion का मतलब उसको ऐसा क्लीन नहीं करना है. हाँ, ड्राई स्वैप लेके ऐसा मत करो, उसको रोटेटरी मोशन में करना है. रोटेटरी मोशन मींस like this, like this, like this, like this. Are you clear?
Yes, ma'am.
Okay, उसको बोलते हैं rotatory motion. So when you perform anything ना, सब कुछ procedure like details करके like try to demonstrate. Okay, next. The next will the rationale of this, okay? Why do you need to remove the thermometer from the antiseptic solution and then directly rinse in cold water and as well as wipe with the dry soap? Why you need to do? In order to remove the it means to remove the disinfectant from the thermometer. This you need to mainly do it in order to prevent transfer of any contamination, okay, from the stem to bulb, because there might be some contamination or some microorganism present in the thermometer na, in order to prevent the transfer of those contamination, okay, all those microorganisms from the stem to bulb. Okay, you have to maintain this aseptic technique. Okay, you have to maintain aseptic technique. Are you clear?
Yes, ma'am.
Yes, ma'am.
Okay. And then now you already took out the thermometer. Okay, you already rinsed it. Now you are ready to keep in the patient axilla or whatever side it is. Okay, you are ready to put. So I told you all yesterday that before directly putting into the patient axilla, what do you need to assess?
Clean the axilla, ma'am.
Yeah, clean the axilla. Okay, that is correct. Clean the axilla. Okay. Then one important thing I taught you all, that read to thermometer. They read to thermometer. Usko Celsius or
Shake it and bring it to body temperature, ma'am.
Yes, very good. You have to that mercury level na pata nahi hai na wo mercury kitna reading tak chala gaya. You don't know na to which extent the reading have already exceed. You don't know na that particular line, because you have dipped into the Dettol solution by the room temperature itself, or automatically the mercury used to rise up, fall down. So you don't know na. So, but before putting directly into the patient axilla, you always keep in mind that you have to shake the thermometer down. Okay, shake down the mercury level by holding the thermometer. Okay, with the thumb. Okay, with your thumb and with your this one, with your forefinger. Okay, you have to hold the thermometer and shake it. Okay. Okay, and the mercury level should be below what? Below what? Kali sikhaya tha.
35 degrees Celsius.
Yes, it should be if the mercury level should be 35 degrees Celsius, या फिर it should be below 95 degrees Celsius. I mean 35 degrees Celsius से कम होना है और 95 degree Fahrenheit से कम होना है. अगर like once you put in the Dettol solution or Savlon solution, whatever it is, if you find that the temperature I mean the mercury level, okay, the mercury level in the thermometer is okay, then no need to shake it. Only if it is beyond 35 or it is 95, then only you need to shake it. Okay, this is the thermometer. Now I have seen that the reading it exceeds to 35 and then it exceeds to 95 Fahrenheit. Okay, and then I need to bring it into the room temperature that is below 35 and below 95. Now, so I need to like hold with my this thumb and with my forefinger like this. Then I need to, you have to shake it like this. Okay, aise mat karna. You have to shake it like this until it comes down below that, like this. Are you clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So now again the rationale is, why do you need to shake like this? Why not put it direct? Okay. Or if you do this procedure that I told you just now, okay, this will help you to record the temperature correctly. Okay. This will help you to record the temperature correctly. Okay. Yes or no?
Yes, ma'am.
Okay, I want to teach you one more, but there is no more time. We will continue on the next class. So let's see Monday if we could complete, then I will see. You understand whatever I taught you today?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, then that's all for today. Okay, thank you everyone.
Thank you, ma'am.
Thank you,
Yes,
ma'am.
ma'am.
Thank you, ma'am.